Welcome back to Team Doctor's Blog. I'm your host, Dr. James Stoxen. Here we are in Kuala Lumpur, Malaysia, and I'm talking about releasing the human spring. Now, I'm talking about the body is a giant spring, 7 floors of springs, and I'm going to go over them with you one more time again. Number 1, you have the arch. That's the floor number 1. 2 is the sub-talar joint here and on this side. 3 is the ankle mortise right here, where your foot kind of moves, sort of like a saddle on top of a horse, like that, on the talus. These 2 bones form sort of like a saddle on top of this bone right here, and that's how they move, okay? And then you have the knee, which is the 4th floor. The 5th floor is the hip, and the 6th floor is the spine. The 7th floor is the head. So we're going to release the 3rd floor, or the 2nd ankle joint. So we're going to put pressure right here where the ankle bone forms here on either side. We're going to start on the inside of that, and we're going to go right off the bone until we feel like a little gap right there where the ankle bone, or the edge of the tibia, distal edge of the tibia, meets with the talus. And there's some tenderness right there, and apply that pressure. You can see my thumb is nice and white here because I'm really holding it down, and it's starting to go away. Now it's gone. And then the joint goes across like this, so apply pressure right across the edge like this, and I can feel some tenderness here too. Then I'm going to go across this way to release the spring on the outside, okay, and holding it down so the pain goes away. And then right here is the last area where we work on the outside. Now, the worst area of this joint is right there. That is because when your foot lands, it lands on the outside, then it rolls to the inside, and then it pushes off. So it lands on the outside, rolls to the inside, and pushes off. It has to remain in a safe zone, a safe range. That's called the rolling, or the supination and pronation. It's got to stay in a safe range. If it goes outside too far this way or too far that way, it's going to twist your leg out of the safe range. So when you feel that, you'll know that your foot is probably rolling too far outside the safe range. So work on that area. It's another helpful tip for you from Team Doctor's Blog. Stay tuned for the next one.